my topic is about an issue that, politically speaking, is about as warm as it can get. It's about the healthcare crisis. I've got to get my thing here, just sorry. I have slides, will travel. It's about the healthcare crisis. There's hardly anything that's more keen, more serious. It stops our government activities, as you all know. I'm also inspired, too, after listening to Dr. Lena Wren and her presentation this morning. It really added a lot of impetus to what I really want to talk about. The healthcare crisis, just for background, I want to share with you just a couple of ideas that I know that you're really quite familiar with, but just to set the stage. The healthcare costs are really exorbitant, and they have been rising faster than the national economy for now a long time. And here is one representation. There's different kind of graphics to sort of present this idea. This is just one. It unfortunately only goes up to 2005, but it shows basically, as you can see here, the rise in healthcare costs on a per capita basis are rising really sharply compared to the consumer price index, or the gross domestic product. Compared to other countries, U.S. costs are higher and rising faster. It's really quite stark. Here it is here. We're leading the pack. The rest of the countries are sort of trending upwards a little bit, respecting inflation. The United States is just outpacing the rest of the lot. Now, if we want to look at this from a slightly different perspective, the healthcare costs are commanding a higher and higher proportion of our gross domestic product, the money that we have for doing various other things we'd like to do. For example, if we plot here on this timeline here from 1970, for example, until 2013, put the GDP on the other axis. In 1970, the percent of the gross domestic product spent on healthcare was 5%. But since 1970, it's now come up to a level of 18%, a rapid rise. That is really sharp. Were we to have maintained a level of 5% from 1970 until now, that's a 5% of the total gross domestic product of the GDP, we've basically 75% of our present costs have been added since 1970. We've spent a lot of money trying to bring this question into some perspective under control. And of course, then the question I think that is fair to ask, what did all this extra money really buy? If we look at the data from many different perspectives, this just being one, what we see here is that the healthy life expectancy in this country compared to comparable countries elsewhere is really not good. We have fewer years of healthy life. A lot of people don't really know this, I think, but it's really quite stark and unfortunately quite tragic at the same time. The U.S. ranks 37th out of some 40 countries in terms of the quality of health care. It's another metric, just looking at the same question from a different perspective. And these are data that were actually obtained by the World Health Organization and published in the year 2000. We still rank, I saw a rank just the other day, looking at the same question, we're something like 48th out of 50 countries, more or less comparable to us, in terms of the quality of health care in this country. I know that may surprise a lot of you, but it's really documented in many different kind of publications. These added costs actually are troublesome, and I think you would agree to that. They come home to us. They relate to us in our everyday lives in a major way. They crowd out school programs because of the cost of the health care that is required to take care of the health care of the retirees from the school system, for example. So they crowd out local programs in schools, unless we decide to bring in local taxes, property taxes, if you will, to sort of help with those local programs. And so schools are suffering across the country as they tend to actually try to hold on to the programs they hold most dear, or perhaps even add some new ones. They can't do it. This problem here limits business growth. it limits the creation of jobs. So this is a real take-home message as far as our political interests are concerned, or social interests are concerned. Healthcare costs are going through the roof. As far as suggestions for figuring out some way, what are we going to do about this? I've been watching the news, of course, and looking at it from sort of a professional as well as a public perspective, sort of looking for those opportunities that if somebody has some ideas of how we can bring this under control, at the same time we improve health. That combination. We got to cut health care costs, but at the same time improve health. So the two have to go together. About the best I've seen is something I saw last June in the Ethical Journal of all places. It made national news, of course. But it was simply this question here. This study suggested, supposedly, that if we made wiser use of our medications, this could cut a lot of costs. In fact, the figure is something like $213 billion that might be saved, for example. That's a lot of money. Sounded quite good when it's written that way. But this assumes if people comply, that is, if they followed what has been recommended here, and they're not going to do that, using drugs, as I say, more wisely, this amount of savings, theoretically, at the most, is still only going to be about 7 or about 8% of total health care costs. So that $213 million really begins to dwindle away, $1 billion. And of course, at the same time, if we follow that recommendation, which is the best that I could find in terms of cutting health care costs and improving health, so the story goes, if we actually followed that, there's no evidence that we would actually improve health by taking that course. And that's the best solution, it seems like to me, that I've actually seen that's surfaced. Now, this brings the question up, what do the present proposals say about how we're going to handle our health care costs? I know all of you know the debate we've had, the so-called debate we've had for the last 4, 5, or 6 years, very politically motivated. It was enough to shut our country down for a couple of weeks. It turns out that if we look at those proposals that I have, whether they're from the right or the left or for whomever, it turns out that from one sense, they're all the same. We argue a lot about this, but basically they're the same. It's basically what they're asking is, who's going to pay the future bill? That's it. Who's going to pay the future bill? Something's missing. And I'd like to share with you an idea that tends not to get into this narrative, into this dialogue, into this discussion. It's our failure to understand an extraordinary ability of nutrition to create health. And this is a sort of a new dimension of nutrition, actually, that's not well known, but it's something that is really quite spectacular. It has the capacity to really make a difference. So the question, and before I get on to mentioning that, the question that arises, of course, is why has this subject been such a secret? And I consider it a secret. Lots of people talk about nutrition. They really do. Concerned about nutrition, in fact. But for the most part, people don't realize what it really can do. And the reason it's not taught, the reason we don't discuss it, it's been this way for some time now. For one thing, this subject, the subject of nutrition, is not taught in a single medical school in the United States. Not the kind of nutrition I'm talking about. In fact, just general nutrition. The best that any university has, I think, is Tufts University, is somewhere around 18, 19 contact hours in the classroom. A lot of schools offer nothing, or at best just an elective. So in our medical profession, nutrition is not a topic for serious discussion. At the same time, in my area, which is in biomedical research, where we get funding from the National Institutes of Health, for example, it turns out that there's little or no funding for nutrition research. There's 28 institutes in the National Institutes of Health, the leading medical research agency in the world. There's 28 institutes, the Heart Institute, the Cancer Institute, and so forth and so on. Do you know there's not one institute called the Institute of Nutrition? The very discipline that has the most to offer, and there's not one single institute insofar as funding of medical research is concerned. If nutrition were better understood, if it were understood as what I I've come to believe is important. It leads to an idea that we can cut healthcare costs simply by decreasing demand. In other words, if people knew about this, we can actually take care of this healthcare crisis quickly and reduce demand. And those proposals I just mentioned, this subject is not even considered. Whether it's in the Obamacare plan or whether it's on alternative plans, nobody really sort of addresses this in any serious way. They're really relying on old information at best, and then it's very superficial. If we understand how to do it, the effect is so important, we can come back to allow us as individuals to take responsibility for our own health. That's the important message as far as this is concerned. It's allowing us, if we know it, to take responsibility for our own health. And I think everyone, right, left, whatever our political and social persuasions are, that's what we'd like to be able to do. But we can only do that if people know the information. And this is something I have found lecturing in various facility places. People don't know this. They simply don't know it. So the question is, we can only take responsibility for our own health if we know how to do it, if we know what the information really is. And so it raises an interesting question. Who's going to provide this information? It's not out there now. Some of us are running around and talking about it a bit, but in general, the public tends not to know. It raises an interesting political question, if you will. Should it be the government? Should it be our employers? Should it be ourselves? Who? This is an important question because the information must be delivered in a fashion that is understandable and actually can be truthful and reliable. The present-day understanding of nutrition comes into question. What is it? It's a misunderstanding. Here's what it is. Most people think of nutrition in a very sort of detail-oriented fashion. We talk about what individual nutrients do. This vitamin does that, protein does this, carbs does something different, and so forth and so on. We talk about these things essentially in isolation. We have a massive amount of information of this kind, but it's all just basically details. It's the threads of the tapestry. It's not the tapestry itself. And so as a result of this focus on details, which we tend to use the word reductionism as a matter of fact, is a problem. Because in reality, nutrition, when it works biologically, and I don't have the time, of course, to even expand on this here, but in reality, if one looks at the biology of the way nutrition works in the body, it doesn't work on a one-by-one basis, one nutrient doing one thing to create one response in the body. It doesn't work that way. We study it that way, we talk about it that way, we think about it that way. That's not the way it is. All of it tends to work together in complex, really a very impressive sort of array of effects that has very broad effects, actually. We call it holism, I do at least. And it's therein is the source of public confusion. And the public is confused. The public doesn't know. Our professionals don't know either, because we're all focused on details. And when we focus on details, we can end up having endless arguments about which detail that we prefer. So, alternatively, I think nutrition, and I think we can show that very easily now in science, it's a holistic effect. And I'd like to use the W here. It's not usually spelled that way, but I want to emphasize the idea it really has to do with everything sort of working together. So here's the way I define nutrition these days. It involves countless nutrients, and I really mean countless. It's not the 30 or 40 nutrients you might see in a textbook or something of that sort. It's really countless. Working together to prevent disease. We've known that, nutrition can supposedly prevent future disease, more or less. But the really important part of this message that it tends not to know, we now actually can use that same formula to actually treat existing illness. So this is a matter of treatment. It's not a matter of just thinking about what we can do to save problems for ourselves in the future. And of course, in that manner, we can restore health. Nutrition, in a sense, is greater than the sum of its parts. It's like a symphony. When you think about all the different nutrients working together and all the different ways in which they can work and have their effects, it's like a symphony. It's really fantastic if you were able to see inside of a cell, the trillions of cells that we have, to see what's going on, to see how that really works. There's substantial evidence now, in fact, showing that ideal nutrition is basically a whole food, plant-based diet. Notice I did not use the word vegan or vegetarian because it's not exactly that. It's a whole food, plant-based diet in a native sort of form. That's made up of, essentially, if you're interested, 80% carbohydrate, 10% protein, 10% fat, with little or no added fat or salt or refined carbohydrates added back to it. That's the formula. And has really, truly amazing effects. Here's just a list of some of the diseases that I had become familiar with through the research, or in fact that we worked on ourselves in our own laboratory. Here's the kind of diseases that for which there is peer-reviewed evidence in the scientific and medical literature. There's real evidence backing what I'm suggesting here this statement says. Namely, a whole food, plant-based diet suspends, prevents, and or cures all these diseases. Actually cures the diseases. Let's just take a look at a few of them. Cancer, in my laboratory, for example, we could turn on and turn off cancer just by nutritional means. We could make it go forward, we could make it go backwards, just by working on from the standpoint of nutrition, as opposed to the other kinds of things we think about. Heart disease, we have evidence now that heart disease need not exist. My friend and colleague at the Cleveland Clinic has shown this, as others have. And people, they can be in an advanced stage of heart disease, they try this strategy, it goes away like that, quickly, and doesn't come back, as long as people are doing that. It's a means of treatment. Multiple sclerosis is another one, a serious disease, one of the autoimmune diseases, chronic in nature, and I think many of you know, it's kind of a progressive kind of disease. It's serious. In reality, now we're beginning to see that even a disease like that, with the same formula, not the same detailed, necessarily working together, but it's the same formula that actually can stop MS. I've run into quite a number of individuals, in fact, who have done exactly that. After, in fact, hearing about this, trying it out, it stops. It's that simple. Kidney stones, you can see the rest. Osteoporosis. Osteoporosis is said to be a lack of calcium, maybe a lack of dairy. Actually, it's the reverse. The higher the calcium consumption, the higher the dairy consumption, the higher the osteoporosis. There's a lot of mythology in the nutrition information that's brought to the public. Diabetes, type 2 diabetes. It's a serious problem. It's rising. Many of you know this. Type 2 diabetes, treated with insulin, things like that, put them on this kind of diet. It is so profound, if people stayed on that same medication, they would go into hypoglycemic shock. That's how prominent is this effect. We can essentially just wipe out type 2 diabetes. Type 1 diabetes, a little more serious, obviously. People may still have to stay on some insulin, if you will, but you can cut the dosages substantially. We've shown this, not well publicized. But in any case, looking at the broad spectrum of these diseases, it sends a message. This effect has a breadth of effect. It's not a single chemical, a single drug, a single nutrient that we tend to rely on, that kind of idea. When we're doing it this way, it has this breadth of effect for all these and many more different kinds of illnesses and diseases that we may experience. That breadth of effect is a different paradigm as far as our practice of medicine is concerned, for example. Furthermore, this effect, when it's put in place, you take people, have the illness, give them this, and this has been done. This has been done. The response is exceedingly rapid. Within days, within weeks, angina and heart disease disappears. And one of the other things that really is kind of interesting, not quite so serious, but 20% of the population have some kind of chronic pain, believe it or not. Headaches, maybe arthritic pains, lower back pains, maybe neurologic or cardiac pains. It turns out that we put them on this kind of thing, most of those pains begin to dissipate and disappear within a matter of a week or two or three, or maybe a little longer in some cases. It's really quite remarkable. The reason this happens is because we're trading off the consumption of two different kinds of foods, actually three different kinds, but here for this purpose, two different kinds of foods, plant foods, animal foods. This basically is just showing you the amount of nutrients present in these different groups of foods. Plants make these things here, which are terribly, terribly important. These are the things that make for health. Animal-based foods don't have that to any significant extent. Fat and protein, both kinds of food groups have this, but in reality, it's the amount that's consumed here that's important. And so when you analyze this complexity from that point of view, the plant-based foods really have all that basically make a difference to create the health. There's a third category. I said there are two categories, so it's actually a third one. We call it processed foods. This stuff you go down the highway, you stop off the convenience store and you buy this stuff. The candies and the cakes and the crackers and the cookies and so forth and so on. That's a category that's not whole food plant-based, even though the ingredients may be coming from plants. They actually could be worse, if anything, compared to the animal foods because they tend to be high in fat and high in salt and high in refined carbohydrates. That's not it. So I come back and say it's really whole food plant-based diets. That's the positive message that has so much to offer. Here's just a quick sort of set of data, just taking a group of people, for example, putting them in a program for 10 days, just give them the food for 10 days. Just average folks. Some have sort of illnesses maybe. Body weight loss of 5 to 10 pounds. Total cholesterol dropping from 196. Statins can't quite do that. Without side effects, by the way. LDL goes from 118 to 86. If any of you are familiar with these numbers, these are big changes in just 10 days. It's really quite dramatic. Triglycerides plummet. So the solution to the healthcare problem, as far as I'm concerned, has been left out of the narrative, has been left out of the discussion. Because our professionals don't know it, the public doesn't know it, and there's where it's at. We could actually take care of our entire healthcare problem if this information were just communicated to the public so they know how to use it. And I'm suggesting, as a matter of fact, and this is a conservative figure, that there's ample evidence showing that 70 to 75% of our total costs can be eliminated just through the proper use of good nutrition. And it's kind of odd, incidentally, I think coincidental to some extent. I told you about the 70 to 75% bloated money that we put into the system since 1970 that has done nothing for us. It's done nothing for us, billions of dollars. In fact, we could actually just trade that off. And if we choose the right course of action, we can actually get that 70 to 75% under control. So my last point I want to make is I just really want to communicate in the best way I know how. This is a story that has not been told since the days of Hippocrates, of the ancient Greeks. It was known then, by the way, not with the same science, but what we decide to eat can have so much effect, just not on our personal health, but on our societal health, even on our planetary health. It's really, truly amazing. Thank you.